All right, and welcome everyone to our first event of the fall season. My name is Garrett Plesko Moore. I use he, him pronouns, and I work with the Eastside Human Services Forum. We are a East King County focused organization committed towards expanding the support and impact of health and human services all across the eastern part of the county. A quick heads up, apologies, you may hear some ringing as I'm providing some introductory remarks as I let the additional guests into the call. The forum is a nonprofit that's been around for over 20 years, and we are committed to our diverse network of service organizations, as well as our government partners and private entities to conduct education, advocacy, and collaboration all across the East Side. We seek to elevate the voices of our member organizations and their leaders, making their expertise heard on public policy, trends, and the needs of the human services sector. So tonight we have a very, or excuse me, this afternoon we have a very fun and an interesting topic of conversation. Over the summer, the forum did conduct a survey of human services service providers, along with our partner organization AEA, to hear what are some of the emerging trends amongst the service providers. What are some of the challenges that folks are facing? Especially coming out of this past legislative session. What are some of the opportunities for improved human services that folks who are completing those services, conducting those services, are seeing in the industry and in the sector? So with that, there were a number of issues that were raised, but the number one theme across most providers' responses was the concern around both consistent cash flow for the nonprofits, as well as retention of staff. While I recognize this is not a new concern, it was underscored as a growing concern for many human service providers across the East Side. And so tonight we have a really great panel of both city staff as well as some of the service providers who can speak to some of that experience and some of the ways that folks are trying to address these concerns as well too. So with that, I'm going to briefly highlight the plan for tonight, the agenda for tonight, before handing it off to our speakers. And so we're going to have very brief introductions. Everyone's going to have the opportunity to introduce themselves, as well as answer some pre-planned questions. But the majority of the night is for our speakers to answer your questions. So please feel free throughout the entire event. You are welcome to drop your questions in to drop your questions into the chat and or the Q&A section. I'll be keeping an eye on both, as well as we may have some support from others on the call who are going to be helping me field some of these questions as well too. There were a few brief questions that were submitted in advance, but we should have the opportunity to get to most of the questions from the crowd as well. So without further ado, I am going to pass it off to our speakers to introduce themselves. And Monique, would you mind starting us off, please?
Yeah, sure. Hi, everybody. I'm also going to be looking down at my notes because I'm really bad and sometimes I forget when talking about myself. So I'm Monique Martinez. I'm the executive director and founder for Tomorrow. We're a nonprofit that serves Bellevue, Kirkland, Redmond, and Sammamish with human services, mental health services, and more. Our organization is proud to serve all community members that come to us equitably, while also specializing in providing culturally sensitive support to the Latino Latinx community, as well as youth. I'm a proud Latina and I'm a Bellevue resident. In my free time, I volunteer myself as chair of the Centering Communities of Color Coordinating Team, co-chair of the Superintendent's Advisory Council for the Bellevue School District, and also on the Bellevue Arts Commission. So very civically engaged. I'm very happy with my community, and I'm also happy to be here. Thank you.
Thank you, Monique. Nura, please.
Thank you, Garrett, and good to see everyone. My name is Noura Adam. I am the founder and executive director of Immigrant Women's Community Center. We're also based in Bellevue, and we also do have an office in Seattle. Um, we work in the Eastside and all over King County. Um, our organization was actually founded on the idea of creating a third place for all immigrants, a third place that is welcoming, healing, that connects humanity. So we're very, very delighted and thrilled to have offered that third space. I am also a certified mediator, so we do mediation services. We do conflict resolution services. We work a lot with families, particularly families uh, where parents are immigrants and children were born and raised here, and where there are oftentimes a drift that's caused by cultural differences. So we do a lot of inner healing within the families to bring the families together by giving them um, conflict resolution tools to sort of work together as a family and to meet the kiddos where they are at, right? To sort of see each other um, uh, uh, especially on the kids. We want to make sure that the parents are seeing and meeting the kids where they're at and supporting them. So 80% of my mediation services are really within families. We have a program calling Healing Starts from Home because we feel if there's pain at home, it's hard to really do anything else outwardly. So we invest a lot of time in making sure that families are thriving, are peaceful, are communicating in a healthy way where they're understanding each other. We also have mediation and conflict resolution training programs for everyone. Our mediation services and conflict resolution is actually open to all, immigrant and non-immigrant. We help families, we help schools, we help employers, neighbors, and so on and so forth. Our goal is to create a space that fosters belonging, community, that brings people together, that really works on eliminating the othering, the negative othering. So that is our focus. However, we also have a case management services. Just during the pandemic, in 2022, we gained over 100 families who were new to our community as refugees, mainly from Afghanistan, some from Syria and Ukraine. Our case managers and refugee support coordinator are all bicultural, bilingual, and have lived experience of what the community are going through. So last year, we actually had a lot of trauma because people, when they flee and they come here, especially from war zone, they carry a lot of trauma. And we were very excited to partner with Zane Counseling, who offers culturally sensitive counseling programs, one-on-one therapy for the community. And I really want to shout out to City of Kirkland, who helped us with funding for language access and digital access for the folks that we were supporting. So that is lump sum of what we do. We have workshops that are also geared towards cultural sensitivity training programs. Our goal is to bring the community together, especially when there's a lot of divisions and the unknown fear. So we are known to be a unifying figure and hope to expand in that circle of humanity. Thank you.
Wonderful. Thanks, Nara. And as we move over to the city staff who are going to be speaking on our panel today, I want to highlight how there are so many different models and ways that some cities have been able to try to address contracting concerns. And so these are just but brief, unique experiences that our city staff are sharing today from the diverse approaches from all across the East Side. So with that, Christy, can I have you go next, please?
Of course.
I'm Christy Stangland. I'm the Human Services Senior Planner for City of Bellevue. I've worked for the city for 6 years, and I've been working directly with contracts for about 3. And in the contracting pieces, it's really around creating the scope of work, overseeing and executing the contract, and then monitoring the program. And prior to my time with the city, I did work for a nonprofit in East King County for the majority of my career, providing services to homeless families and low-income families.
Wonderful. And Reggie, please.
Thank you, Garrett. Reggie Schubiger, she, her pronouns. City of Kirkland, I'm the Youth Services Coordinator. I'm one of 3 coordinators in our Human Services Division here at the City of Kirkland. I have to add that I am pinch hitting for my colleague Annie, who was supposed to be here today, so I will do the best I can. If I can't answer any questions, I am more than confident I can pass them on to Annie, and she will definitely get back to you. So that said, I've been with the City of Kirkland for about 27 years. I just started with the whole contracting process for this funding cycle. Similar to what Christy said, also responsible for executing contracts, monitoring, doing the site visits that we're doing right now too. So it's been a great learning experience for me as well. Thank you for having me.
Wonderful. Thank you, Reggie. So I know each of you may have touched on this a little bit, but I would love to hear a little bit more specifically from you, either as a nonprofit or city staff. What is your connection to the contracting process for human services on the East Side? And we are going to jump right back to the agencies. And Nura, would you mind starting us off this time, please?
Absolutely, and thank you, Garrett. So we are a very young nonprofit organization, about 3 years old, so we're really a toddler in our toddler stage, but we have grown rapidly last year. My connection to the Eastside community is, first of all, I have lived in the Eastside for 27 years, the entire time that I've been in Washington State. 3 of those years were in Kirkland, where my journey started, and the remainder in Bellevue. We're still living in Bellevue. All of my kids were born and raised here. So we have a deep connection to the East Side cities, as we've been here the entire time. So far, I would say that we really opt on applying for funding in the last funding cycle because as a young nonprofit organization, we had cash flow issue. We could not do that, the reimbursement model. We didn't have upfront money to spend and then to report and get reimbursed. So as much as we needed the funding, unfortunately, we opted out. And that was such a painful decision for our organization to make. We were, however, very fortunate last year, and I'm really going to go ahead and shout out to City of Kirkland here, who reached out to us, and specifically the 2 amazing ladies that came to us and reached out to us were Jen Boone and Antoinette Smith. Have heard about IWCC, wanted to learn more about what we do, what sort of support we needed. I was truly touched and amazed by the level of empathy that they had, how much they wanted to support this community. And they were also able to listen to our concerns and the barriers. The reason we could not apply for funding in the last cycle is because lack of cash flow. And we were needing a grant that was in place at that time for digital and language access. And as we were trying to help all of these communities that are either really carrying trauma from war or victims of domestic violence, where language barrier was really a huge thing, and digital access, we couldn't do without that. And so they heard us and wanted to make sure that we had what we needed to support the community, and worked with us to make sure that we get 50% of the funding advanced so that we can help the community, report back to the city, and then once we use the second half, do the same thing and report back. That was the biggest gift we have ever gotten from from any city funding. Really, they were the first ones, the first city to fund us, and I'm here today because even though last year we were responding to a lot of crises and communities coming from so many different backgrounds, this year we were fortunate enough to have built some foundation and to connect with our Eastside providers, learn what each one of us is doing so that we can collaborate and help refer people to each other and, work together hand in hand. It has been a blessing to have also learned that what we have been going through and still going through is a shared experience by all of the grassroots organizations, the ones that are emerging or the newer ones. So I am thrilled that we're here together today to have this conversation before the next funding cycle starts so that we can brainstorm and figure out a way of helping these younger emerging grassroots organizations that have cash flow issues. We did also get funding for COVID workshops from City of Redmond, which was amazing. But I just really am here today to be part of this dialogue and to see how we can work together to really shift that needle a little bit and find a way of helping grassroots organizations be more sustainable. Thank you.
Thank you, Nora. And Nora, you're given a great preview of some of the direction that I'm hoping the conversation will go with others as well too, as we share some more experiences from contracting and service provision across the East Side. So, Monique, can you introduce briefly how your organization is involved in contracting these days, whether with local municipalities, state, federal, all the way up?
Yeah, of course. Like Nora said, we're also a new organization, but one of our strengths really came from starting out with federal funding, so through King County, and then eventually through the cities, so ARPA funding, which is more federal. We've also been in contracts with general funding, CDBG funding, and 1590 funding. So lots of different funding sources and lots to balance. So excited to kind of unpack some of that later today and talk through it.
Monique, for those who aren't familiar with the sources of those latter couple, can you expand a little bit, please?
Yeah, of course. And maybe Christy can speak to 1590, but ARPA, I think we've gotten ARPA through a few different cities. So each city has the American Rescue Plan Act funding for specific things. Ours was specifically in the beginning for eviction prevention and housing stability.
Yep.
And then CDBG is the Community Development Block Grant, which is also federal HUD dollars. And it's a lot.
Yeah, thank you. I just know it can turn into alphabet soup for a few folks. So thanks for explaining that as well too. And Reggie, would you mind sharing very briefly additional beyond what you said before about your experience in contracting?
Sure. Yeah. So again, I'm one of three that are responsible for all of our programs and the contracting process. We're divided into areas of expertise and or interest amongst the three of us. So my focus is mostly on the youth programs because that's where my passion lies. And then outside of the contracting piece, I have been involved with our Human Services Commission going through the review process for 3 grant cycles. So I've seen that end of things for several rounds. So yeah.
Great. And Christy.
Yeah, so Monique covered a lot of our funding sources. And so have been involved in overseeing the CDBG, the ARPA funding, as well as the 1590 funding, which 1590 funding we now call Housing Stability Program. And that is the tax funding that came through that a lot of cities collaborated with King County, and it has resulted in the Health Through Housing project. City of Bellevue chose to keep their dollars internal, and so it's broken into a couple of different efforts. We do get 15% of the funding comes to Human Services to provide housings or services that are co-located or focused on homeless populations around behavioral health and housing stability. And then some of the other funding is partnering internally and then with Arch, and it is around housing stability as well as some operation and maintenance and services funding. And so we did some restructuring as we hired our new manager recently, and so I will be overseeing the general fund dollars and the housing stability dollars moving forward.
Got it. Okay. Well, thanks everybody for answering that pretty in full, as it helps, I think, all of us understand a little bit more where everyone's coming from in their answers. So with that, a brief reminder, please drop your questions into the chat and/or the Q&A section so that we can start to organize those and get those ready for the open part of the discussion in a moment here. So turning back to our city staff pretty quickly here, can you share a general overview for the, I'll say, standard contracting process? I know that that word standard is doing a lot of work, but if you were to talk about the average grants that your municipality is providing within Human Services, what is the typical flow for that? And Christy, we're going to go back to you on this one.
Great. So I just want to start by saying that every city's process is different. And so since you're only hearing from 2 cities, that it is different across the board, but all of the city's goals is for the funds to be dispersed to agencies so that you can all do the important work that you do in the community. But at the same point in time that we have to ensure that public funds are being used in a fiscally responsible way. And that is why there are so many steps. So I will say Bellevue has a lot of steps. I will go through them and hopefully not put anybody to sleep. But I will stay at kind of high level. So if people have more questions, feel free to let me know those. So once our funding recommendations are approved by council, so our Human Services Commission makes the funding recommendations, they go to council and council approves those or has the ability to make changes. Then staff start working with the agencies on a scope of work. And a scope of work is really what work is going to come out of those. So what are the outputs and what are the outcomes that are expected out of the funding that we're dispersing? And so we use, as staff, we use the application information, and we then take a proportional amount of what an agency said. I'm going to serve, I'm going to do 100 hours of case management for $1,000, and they only get $500. So then we would, in their contract, we would be putting 500 as their service unit or output. And we put all of that information together, and then we send it to the agency and we say, can you please review this? Can you please make any updates? Let's work together. There's times where I will say to agencies, I think that what you're really over committing compared to what we're for the cost of service. So let's think of what is reasonable for the amount of money that we are awarding. Or it could be the opposite of you're really not for the amount of money. I think that is this really proportional to what you're doing. So we look at the cost of service and we ask them to then fill out their budget. And then we really partner with the agencies. We want this to be something that allows the agencies to have measurables and really show the impact of their work, because that is what our council, that is what our commissions want to see, is what are these agencies are doing amazing work in the community. So how do they package up their work in the way that the city needs it, so it really shows the impact. And so then at the same time we're finalizing the scope of work, our senior contract admin is reaching out to the agencies to gather all the documents. And we only require agencies to submit documents that are legally required to be maintained by state or federal laws. But it is sometimes a long list. So, it's insurance, it's if there's federal funding, SAM.gov registration, L&I, we check L&I and Department of Revenue information. And then once the scope of work's finished and every document that we need is gathered, then the contract process now finally starts. And that's when our senior contract assistant compiles everything. They send it to procurement. Procurement reviews it. As long as everything looks good, and if there is problems, they'll send it back to staff and we'll work with the agency. Then the information is entered into DocuSign. Our legal department then reviews it and they approve it. And then it is sent to the contract signer. And then once the contract signer signs it through DocuSign and it comes back to us, then it goes to risk management and to our assistant director to be signed. And then after that, the contract is finalized. It's then sent back to procurement and it's entered into our internal database. And then it's sent to records to record the contract. And the contract is now finalized. Do you want to talk about what we do after the contract's finalized, or?
Very, very briefly, if you could.
Okay, perfect.
Yeah, thank you.
So then staff then monitor the contract by reviewing quarterly reports. So we operate the funds. So we look at the quarterly reports. We make sure that we do a funds for service model. And so we do pay based on the amount of services that are provided. And so we look at that. If there's discrepancies in what was requested, then we do reach out to agencies. We also monitor the spending. So if we notice somebody's only spent like 25% of the award and we're in Q3, we do reach out to agencies like, hey, what's going on? Can we support you? Are you going to be able to spend down these funds by the end of the contract? And then post-COVID, we've also became really focused on monitoring visits again. And maybe I shouldn't say post-COVID because I have a couple coworkers out with COVID right now, but normally functioning with COVID, I guess. We have started monitoring visits. And so this year we've been gathering all the policies and procedures and working like quite a few questions with the agencies. And then City of Bellevue will actually continue every year having some kind of monitoring visit with really the thought of like the off years is it just to be an opportunity for us to sit down, for me to be like, Nora, let's talk about what's going on. How are things going? How can we support you? Monique, I've heard this in your community. How can we make sure that the services are needed and happening in your community? And really, as staff, our goal is to be here to support the nonprofits in the community, because without the work of our amazing nonprofits, our funds don't have the impact that we want them to.
Thank you, Christy. Appreciate you sharing that in detail. It sounds honestly quite similar, having worked with nonprofits that have contracted with other municipalities on the east side. Very, very similar experiences there. But that said, Reggie, is there anything else that you'd want to highlight beyond what Christy just shared that might be a little bit different in Kirkland for contracting?
Yeah, it's really, really similar outside that each of us, the staff that are assigned to the contracts, we follow them all the way through. So we don't have other people looking at it. Obviously our city attorney signs it, all that stuff, but we follow it through the whole process. And I don't know, Garrett, Annie and I talked a little bit about if it would be helpful to talk about the process of how how we decide who's getting what, or not we, but how our commission decides on who's getting what, that whole thing. Would that be of interest to chat about?
That would be really helpful. Yeah,
Okay.
I think, again, for in Kirkland in particular, but I'm sure similar elsewhere.
Sure. So we and about 15 to 16 cities are we all do the same applications as Share One. I think many people are familiar with that whole process. And so that usually starts in the spring of the year before the cycle. So that meaning it's coming up this next spring in like 5-6 months, which is kind of scary, but it's coming. And so the cities in the collaborative do some informational workshops and do some outreach to agencies to answer questions, help them navigate through the Share One app, because it can be, especially for first timers, a bit overwhelming. There's a lot of stuff in there. So we do that initially. And then once all of those are submitted, I think Bellevue does a pretty similar thing, but we as staff, of course, organize everything and then present the information or the applications to our Human Services Commission, and then they review. When we were doing it last go around, we met, I think, just about every week for a while there, so it was a lot. They organize their review based on our 5 categories. So we have housing stability, supportive relationships within families, neighborhoods, safe haven from all forms of violence and abuse, healthcare, and then education. So they will piece their way through all of that. It's an interesting process to kind of see how they deliberate all that. We of course answer questions, as hopefully some of us are a little experts in some of the areas that the nonprofits are focusing on, and then the review is hopefully completed by the end of August, and those recommendations are then presented in the fall to our city council as part of the city budget review process. And usually that's finalized in early December, around that time. And then just like Christy said, after that, we start doing all the contract stuff. And then as soon as those are done, we start reviewing the quarterly reports. It seems like Q1 comes in as soon as you finish the DocuSign thing, and you're ready to go. So I don't know if Christy has anything to add to that.
I'd say it's really similar currently with City of Bellevue. We are in the middle of a strategic plan, which we do believe will adjust how, like possibly different priority areas, possibly a different structure for reviewing applications. It's really unknown at this point in time. We do expect that to be finalized before, I believe it's going to council in February. And so along with our needs update, which we're at the process that we're wrapping up right now. And so, and many people in this call were a part of that process. And so ours may change in our next funding cycle, but at this point, that does kind of represent what we've done in the past.
Great. Thank you both for that thorough explanation. I think really helpful for some of the service providers who are in our audience today. So turning back to Monique and Nura, I know, Nura, you did address some of this already. So if there's anything you wanted to add, you're welcome. But I think we'll start with Monique of what are some of the challenges that For Tomorrow has been experiencing when trying to contract with public entities?
Yeah, some of the challenges that I think a lot of nonprofits have to navigate, and we're definitely not immune to it, is the reimbursement model. I think Nura definitely spoke to it already. If it's a quarterly reimbursement model, then we're waiting 4 or 5 months to get repayment, which means we're floating 4 to 5 months expenses. So that definitely can be a barrier to getting new contracts, figuring out if we have the capacity or the cash flow to do that. Another thing would be reporting requirements. So when you get different funding sources, each of them are asking for different demographic information, or even just how you report residents. Maybe one might say, okay, it's everyone in the household, and then the other one would say it's just the household, head of household. And so just figuring out the little details that each of them are just tiny bit different, and balancing all of those is definitely a huge challenge in our community. I would also say administrative burden. So from the 1st to the 10th of every month, don't talk to me. I have a lot of reporting to do. And then every quarter, right? The 1st to the 15th and the beginning of the year, like I'm out, and so is some of my team, because there's just a lot to do when it comes to reports and reporting. And so I think in addition to all of that, auditing is another one that's new to us, right? Totally understand we need to be fiscally responsible and be held accountable. But I think that the administrative burden on an audit is sometimes misunderstood. And so, just thinking about a first year audit, and how much work that takes on staff side. And then the price of the audit. I mean, it can be upwards of $40,000 and it could take 6 months to do it. And so that's a huge challenge, and learning how to navigate and definitely trying to figure out how to do things more efficiently and balance all of these. Yeah.
Yeah, just a quick follow-up there, whether to the audit or any of the other points you were talking about, Monique. How would you say that impacts your staff, especially the programmatic staff, that may have to come off of some of their program time?
Yeah, I mean, definitely, I think all of us are in this work because we love the work and we're good with people. We want to help people. And so pulling us out of that to do all of this administrative work definitely does take a toll on other staff who are having to take more of the burden of doing the one-on-one or staff support or direct service with community, because we're kind of out of commission and drained from all of the administrative stuff.
Got it. Okay.
Thank you.
Nora, can you please speak to some of the challenges that IWCC has been facing when it comes to contracting with public entities?
Absolutely. First of all, I want to thank Monique. She really nailed that well and identified a lot of the issues that we also face. I would say, to begin with, I think it's really important for emerging organizations or grassroots organizations to have capacity support funding. Because if you are starting a new organization with so much passion, but with $0, it can really take a toll on you and the folks who share the passion, right? And so I'm an advocate for really creating capacity support funding for young organizations who are making a difference. Every organization here is making a huge impact in the community. And so, one, I would say that I would love to see that happen for the younger grassroots organizations that are coming with nothing or are stuck because they ran out of funds and now they can't retain their staff, unfortunately. So we are an advocate for making sure that families or individuals that we work with are thriving and reaching their potential and being self-sufficient. And 90% of the time we're successful and they're giving back to the community. However, we need to make sure that we start that journey from home, from IWCC, that we are paying our case managers and our staff a livable wage with benefits, making sure that they are being nurtured, because you can only nurture others if you are first getting that nurturing. And so when we get into this dry funding stage where we can't keep our beloved case managers who keep this organization going, lack of funding, then we really are failing the community that needs our help, whether it be homelessness, whether it be victims of domestic violence, or whether it be new communities that are coming into our region as a refugee, and so on and so forth. The problems are too many. And doing all of that work as a volunteer, and at the same time having to really take time away from that work to do the reporting and the admin work can be problematic. So I do agree with Monique. We probably need to come up with a way of simplifying the process, so that way we are not taking too much time away from the work that is really essential for the community, but at the same time being physically, being responsible and spending the money the way we should and reporting it the way we should. So that has been a huge problem for us, is retaining staff due to lack of cash flow and having that capacity building funding. For example, this year we're again, refocused on mediation, conflict resolution, sort of healing starts from home programs, because people are hurting. People are grieving alone. People are feeling lonely. They want to have a space where they can belong. We are trying to bring the community together and really reconvene a healing space that offers and fosters humanity and brings people together, and helps people going. And we can't do that without funding. We've been doing it now for with our as a volunteers for what, before even IWCC was born, right? This work has been happening. But in order to be sustainable, and in order for us to continue the work that we're also doing well, not only IWCC, but all of these amazing, incredible nonprofit organizations that do so much for the community, we really need to be nurtured as well and supported financially, so that we're able to focus on serving the community the way we want to serve them, with respect and dignity and humanity, and make sure that every individual reaches their potential while maintaining our staff and making sure that they're also being nurtured. So that has been our issue. Thank you.
Yeah, Nora and Monique, thank you for sharing from the heart there. And I hear in both of your responses this acknowledgement of both organizational leadership as well as service staff, even community members who may volunteer or are receiving some of the services as well too. Treating all with as whole humans, acknowledging that we're whole humans who are all experiencing the last couple of years of the pandemic, as well as the emotional scars that come from that as well too. So I really appreciate those responses that are not just focused on like the nitty-gritty paperwork, but the humans behind it too. So thank you for that. I'm going to turn back to city staff, and I recognize we are. I want to leave plenty of time for some of these questions that are coming into the chat and Q&A from members of the audience. So I'll simplify this next question for Christy and Reggie to say, there have been some opportunities that that both Bellevue and Kirkland have found and been able to succeed in terms of making some shifts that had significant impact on contracting for the agencies. And I want to recognize as well too that there are many municipalities, whether local, county, state, that have tried to do some of the changes that I think are going to be highlighted in a moment here, and that there are often very difficult roadblocks to making some of the significant changes. And so I would love if you could highlight what were either the moments of opportunity, or even just happenstance even that may have been there for some changes to take place in how Bellevue and Kirkland contract. Whoever would like to jump in first is welcome.
I'll go first because Nura already covered our example. But I do want to, and because I'm a little bit removed from the process, I can just, well, as an observer, I can tell you that Jen and Annie asked those questions, and they were willing not to be satisfied with that's just the way it's been done in the past. They met with our city attorney. They met with our insurance, I can't remember the abbreviation, the Washington City's Insurance Authority, to ask if these were things that we could do. And so I think it's just that shift in looking at things and questioning, does it really need to be done that way? And of course, there are some, we have a lot of restrictions and requirements and parameters on much of this money that we give out, but there are opportunities, like with Nura's example, where we can do that. And so I think it's asking the questions is really, really important. And I think there was a question about if we had to go to council for that. We did not. We just met with our legal department and met a lot with our legal department and at the state level, as far as the insurance piece goes, and we got the green light. So.
Reggie, quick follow-up. Could you share in a little bit more detail what that change was, like how many potentially agencies it impacted, or grants with those agencies it impacted? What amount of that money was able to be prepaid? Any other detail you could share for those changes that were made?
Sure. So it's a one-time deal. It was with the NERA's agency, and it was one-time pandemic funding that we had. So again, it's different than the cycles, the biannual cycles that we have. So that's what made it a little bit different.
And I'll just add, it's actually twice because we also were
Yes,
able to
sorry,
receive.
Monique, I forgot.
No, that's totally fine. The advanced payment model from Kirkland, which was really, really, really helpful. And so with the ARPA contract, it was 25% of the total contract you can ask for in advance in order to do the work. Thank you, Kirkland and Bellevue.
Is anyone aware if it was the federal dollars in particular that made some of that possible? Especially Reggie or Christy, if you're aware.
So I can speak to kind of how it happened in Bellevue and where we're going. So in Bellevue, our first tranche of ARPA dollars, which was about $7 million, was set aside for rental assistance. And Monique actually came and said, I would love, and really with the focus of making sure we are connecting with community-based or agencies so that there was culturally appropriate or culturally responsive and linguistically appropriate services. And Monique came and said, I'd love these funds, but I can't put that money up front. And so that kind of started an internal conversation. And I think that really like guides to providers do have a lot of abilities to change things, and we're here to listen. And we will work to change it as much as we can, but it really is depend. It does take time at times. I think that our direction from council, because it was so making sure that we were reaching the communities that were the most disproportionately impacted through COVID, that we were able to make this change and do the advance payment. It was something that never had happened before. There had been conversations about it. There was always red tape or some reason. It was, it's a huge risk. You're giving large sums of money to an agency. And so as a city that needs to make sure that we're being fiscally responsible of our tax dollars and our funds coming in, it was like, no, we can't do that. And so it was, if we are really saying this is the priority of our city to make sure that the most disproportionately impacted communities receive this funds, we need to be willing to put the systems in place and to allow for advance payment. And so it was through ARPA dollars is all that we have done the advance payments through currently. And but we also, as City of Bellevue, were very fortunate. Our council allocated $17 million of ARPA funding to human services. And so it also gives us a bigger ability to say, wow, look at how successful this is. And we haven't had anybody not be successful. So we currently have our second tranche of money was $10 million, and we offered advance payment for that funding as well. And I will say not every agency asks for it because we do require the agencies have to submit monthly reports to us. And like Monique said, it is 25% of their award. Once they've gotten down to spending 85% of it, they can ask for their next chunk or tranche of money, the next 25%. They do have to show kind of like where they are. For rental assistance, it was pretty easy. I'll use Monique as an example. She would say, I have 100 people on my waiting list. I have 6 in process, and it will use down those funds and additional once I pledge that money. And so then we could then process the next advance payment. And so I think it was, it was really the silver lining of COVID for me and my work. I feel like it was kind of that, I don't know if the needle would have been moved as rapidly. And it was kind of like, we need to get this funding out. We were really lucky. We had a lot of funding. And so it made a huge change. It is something that City of Bellevue is planning to do for our future funding in our next human services funding, because because it was so successful. Again, it will be a pilot. It may be, we may have challenges in the next funding cycle. We're hoping not. We really, I will say, as we've I think COVID just, we had a lot of people retire, a lot of changes in staff. And so I think also we have really worked to build our relationships with the agencies so that when there is a challenge, it isn't like, oh, I have to call Scary Christy and talk to her about this. And she's my funder and she's going to say, you're not getting funding in the future. That it really is, we are on the side of the nonprofits. And so it all started with the ARPA. I know that, again, we are fortunate because our city allocated $17 million to our human services and we were able to pilot this, and not all of the cities had that ability to pilot it, and still does have to have a lot of those internal conversations through risk management, through legal, through finance. And there were red flags brought up, but our council priorities is really who guided the change for us.
Wonderful. And Christy, you're providing a great segue to a question. I just want to highlight, Mari, I am getting to your question, I promise, but this is too good of a segue here. So if anyone, especially on the city staff side, can address what are some of the risks associated with this advanced payment model and any other negative consequences that were highlighted or have had to be overcome with this new approach.
You want me to keep talking, Reggie, or do you want to jump in? Okay. So I think what was highlighted during the process is we are giving large sums of money. So for one agency, they were awarded upfront $3 million. So we give them 25% of $3 million upfront. That is, from a city perspective, that is a large amount of money that we're saying, here you go, do the work. And it worked. It was something that it was, if they didn't provide the services, they would be legally required to pay us back the funds. That was part of the advance payment process. We have paperwork. They have to submit documents with every request. I mean, there was a lot of legal work behind the scenes that happened. I know some of the other cities have borrowed that from us and kind of been able to duplicate some of the work as well within their cities. But it's scary to think you're handing this large sum of money over to an agency. And I think also with COVID, a lot of our community-based organizations that were newer and still like growing, there was a lot of ask of them, and they didn't have this historical like, oh, we've been functioning for 30 years. I mean, both of our nonprofits on here on this call presenting, both are newer in the nonprofit world. And so it was, yeah, they've done really great work this time, but wow, that's really scary to give this newer nonprofit this really large chunk of money. And we're like, well, we believe in them. And then there was a requirement that we did monitoring visits that were followed the federal guidelines, which Monique had the pleasure of going through one. It was a lot of questions and a lot of details. And the fact that they submitted documents to us monthly, I think that also, like if there was something that, and Bellevue does ask for backup, which a lot of the other cities don't. So it gives us the ability to really look if there's something that is kind of like, okay, this doesn't quite add up. I could call Monique and she'd be like, oh, I mean, I don't think this ever happened, but it could be, oh, I just forgot to include this document. Let me scan it over. So it was the ability to be able to catch some things early on, really just that in that constant communication. And so I think there was a lot of, and because it was federal funding, there was a lot of requirements. So I will say there was a different staff that actually started up the process and then left. And so when I took over, it was probably 3 or 4 months into the funds being executed, and I was still probably getting calls on a daily basis like, is this okay? Is this okay? So I knew the agencies were being very cautious in making sure that like every T was crossed and every I was dotted. And so I think that also from our leadership perspective just felt a little bit more comfortable.
Reggie, anything you want to add there?
No, I think she covered
Thanks.
it.
Well, sorry, Christy, the next question is directed at you, but if anyone else wants to jump in as well too. On a bit of a different topic here, referring back to the 1590 funding that was mentioned earlier, and would love if agencies want to respond on this as well too. Is the 15% of 1590 funding adequate for the present needs for homelessness?
So the 15, I will just to specify, the 15% that Bellevue allocated is the 15% of those funds that actually come to human services. The whole pot of money for Bellevue is allocated for homeless housing. And so I don't think I can say 15% is not adequate, because I think the whole pot of money is going towards it. I think the biggest thing is the amount of funding we have in general across all services isn't adequate. Every single RFP that we have released, going back from the time I've been at the city, has gotten at least twice the amount of requests of the amount of funds we have. And that you think about the fact that with ARPA alone, we had $17 million. So other than the 7,000 or 7 million for rental assistance, I will take out of the pot, because it was kind of a, we gave out funding. There was more need at the end, but the additional 10 million, there was, and 20 million in requests. So it's like, no matter what we have, it seems that there's never enough. And as a community member, there also is the funding cliff of realizing ARPA funding is coming to an end, for at least for City of Bellevue, will be the end of 2024. So how is that gap going to be filled? It feels like COVID kind of ripped the Band-Aid off of the human services need. We all knew it was there and we just kind of put Band-Aids over it. Now we're like, wow, there's a really big need in our community. So I think not just for 1590, but I think just in general that there's not enough funding. And as a city staff, knowing that when we look at the budget, it's also one of those things that funding is needed over all of these areas. So how is that handled? And so we're hoping that our strategic plan will highlight some of those things.
Anyone else want to add to that, and the obviously a greater need than there is funding for?
I will just echo Christy with, the ARPA and COVID related dollars and kind of those funding sources dwindling, and really looking and questioning the cities on like what next, and just posing that question, because the need doesn't stop and it's just continuing to grow. And so with those two competing factors, it is a scary future to look into.
Definitely. So next question up we have is, what are some other possible operational, and I'll expand this out to other changes that you could see could contribute to better cash flow and or staff retention for human service providers? And this is both a question that I would pose to Monique and Nura from the perspective of like, are there creative ideas that folks, maybe other partners, have highlighted could make a big difference for you or for them in your work and for your staff? But I would open it up to city staff as well too, if you've heard of other methods, other models, even from perhaps municipalities outside of East King County or even Washington State. So please, anybody who would like to jump in for this part.
I can start if you like. Or just say, we've been talking about it this whole time, the advanced payment model. It's beautiful. It works. It's a trusting relationship between both sides, and we're doing constant reporting anyway. So there's a lot of collaboration in that, and I think that's one of the best ways to really help nonprofits and the community ultimately. Another thing, if that's not possible, I think with quarterly reporting, is changing it to monthly reimbursement if advance payment is really, really not possible. But advance payment would be number one. And I will say, you know, both or all three, Kirkland, Redmond, and Bellevue, have given us that opportunity and that option this year to do a monthly reimbursement model for some of our bigger contracts, and it's been a lifesaver. It's been really, really helpful. So additionally, just like technical assistance for some of those really big pieces on auditing and accountability, and the administrative burden and admin fees. I know for ARPA specifically, it's capped at 15% administrative fee. And within that, you have to pay your taxes, you have to pay your staff, and you also have to pay auditing and accounting and whatever operations you have. So it's a big burden sometimes.
A quick follow-up on that one, Monique. So obviously, like if the percent of that funding were larger for operational expenses, great. But is there any perhaps specific training or other areas that funding could go to that you think would be really helpful for tomorrow?
Yeah, I mean, I think the technical assistance piece, especially for nonprofits who are new and barely hit that threshold of like, what does an audit look like? And from the city's perspective, how can they help us prepare for it? And are there resources? Are there accounting firms that are already trusted, and maybe give a little bit of support to nonprofits as well through that process? I think, yeah, there's quite a few things we can definitely get creative and strategize around.
And Nura, I saw you were going off of mute, please.
Yes, yes. I was just going to add on. I think the advance payment should really be given a strong consideration because far too many grassroots organizations cannot put out even a monthly fee or cost. And so that should be, I think, looked as a need-based, right? If an organization is further out there and can handle the monthly reimbursement, wonderful. But I think for those younger, emerging grassroots organizations that don't have anything, I am a strong advocate of absolutely an advance payment and requiring the reporting. I think our relationship with the city of Kirkland has been amazing. We were able to, Jen and Annie have shown us what the human, really what a human services department can do for organizations like ours, to come in with empathy, to ask the questions, to go up and advocate for the need so that we're able to support the community. So I think I really believe that that is what's needed, and not just for us, but like I said, this year we were able to get to know each other, all of the Eastside community partners, and speak about these needs and the need for advance payment. And it is all of us who are so tiny, who really need to, who are doing incredible work for the community, who do need that capacity building fund and that advancement model. And I see Annie joined us. Thank you, Annie, for joining us. I have been speaking about you and Jen and your amazing work and what you have done for this community. So I definitely do advocate for absolutely, please. And I don't want the cities to be worried about newcomers. I think those relationships develop, right? Just as it has developed with myself and Monique, right, for Tomorrow and IWCC, all of these other grassroots organizations are passionate about the work that they're doing. They do so much for the community. I encourage you to reach out to each and every one of them. specifically the ones that are working from the East Side that are doing incredible work. A lot of them are here today. And I encourage you to reach out to them, to visit with them, to get to know them. They are beautiful, beautiful people, and so are you. And so I think this is a collaborative effort that is so well needed. And my only hope is that we can make this change before the next funding cycle. Because if this change does not happen before the next funding cycle, then we are really failing the community. I will say that in very strong terms. If it does not happen, then there is a huge impact to a large community that we are serving. So I hope that this conversation continues. I hope that we could have platforms like this where we can get to know each other more and talk about the barriers and how we can make this possible together, right? So that we are really serving the community in a holistic manner. Thank you.
Thank you, Nora. Thank you, Monique. Christy and Reggie and Annie, I also just made your mic enabled as well too. If you'd like to add in anything, I'll give a brief introduction. Annie Smith is who is originally on our panel for today as well too, from the city of Kirkland. So would love to turn back to city staff. Anything more on that note of other methods, other approaches that you may have seen other municipalities working on, trying for, or maybe even successfully getting to help improve cash flow and staff retention for human service agencies?
I had just a couple of things. So the monthly reimbursement, that is something that City of Bellevue does offer. And so if there is agencies out there, we tried to spread the word, but I know sometimes when we send emails, there's so much information in it that is something that is offered that you can submit monthly. A couple of ideas that we've kind of floated around internally that we've seen done other places is having a set indirect cost percentage, so, or indirect admin. And so like I think it's federal, it might be state funding for behavioral health, there's actually just a set amount. Is this percentage goes to that. I have seen during my time at the city, especially our community-based organizations that are there's a fear of saying like, I want to ask for these needs to be able to actually like function and cover these costs, because so many of them start out with volunteers, and going from that volunteer model to that model where you're paying staff, there's the like, oh, I want all of the services to be able to go towards the individuals that we're serving. And I think that like the comments that were made early on around, we have to be able to support our staff. We need to make sure that their needs are being met. And so how, as a city, can we look at putting that in place so it isn't even something that is like a decision an agency has to make? It's just like, whatever your award of, this percentage is what we're going to be putting for indirect admin. So that's something that we've seen done. We've kind of talked about. We haven't landed anywhere. Our commission has not approved it, which they are approvers of those things. But it is something that we have talked about and has been brought up during our strategic funding process. I think one of the other things that always comes to mind, I know a lot of our nonprofits, especially that are larger, have good corporate relationships with corporations in our community. But, you know, the East King County does have a lot of large, wealthy businesses. And so how do we better tap into that? Is there a way that it could be done collaboratively so it's not everybody going individually? What would that look like? And this is just me just throwing out a really random idea, but I think that is something that crosses my mind, especially as I'm like going through downtown Bellevue, or I'm driving through the Microsoft campuses. Like there's a lot of money, and there's businesses that want to contribute to our community. So how can we do it in a strategic way to make sure that it goes to all of the different agencies?
Not random at all, Christy. Seattle actually has dug into that approach as well too. So, Reggie, did you have anything to add there as well?
I don't, but maybe Annie does.
So I've missed what has been talked about. I do want to also kind of reiterate what Nura was saying. As far as new organizations, I think that is often a something that is brought up, and this idea of like, can we trust? We don't know. How will this end up if we do this thing? And I think there's different ways of doing this. This advance payment, right? And I think each city or municipality can find their way through that using other templates, right? So while ours was a pilot to begin with, I guess to some extent, we've had really great success in that process. I think it's shifting it over to the greater funding that is more of a challenge, right? And we need to have kind of more folks on board on the east side to be able to really fully realize that. But thinking about like, is this going to be long term? Maybe that's one of the things where we're thinking about this as the short term, and as agencies grow and become, their capacity grows, right? They're not needing advance payment long term, right? So it's now as we're beginning and we're getting our footing. This isn't going to be something that's going to be a forever kind of way to manage our funds, that at some point we're going to be able to put those funds up front, and we're good, right, with the support of this funding source. And the other thing I would also encourage folks in different cities, I think one of the things that's really awesome about the city of Kirkland is we have lots of new folks in here, and not coming from the government side, right? So new in this process, and we're saying, so why do we do this thing? Why is this a way that we're doing it? And not in a contentious way, but it's like really give us some more information on why we ask for these things. So say for insurance, right, requirements. So that's one of the things that I remember saying, but why though? Why are we doing this? And that actually led to change. So I think it's not always just how payments are done, but it's other burdens on small agencies and all agencies, right? Of like, what are things that we can eliminate that really aren't necessary, and there's not a justification. Sometimes it's harder to make the change, to make the change instead of just leaving it as is. And I understand that, but when you have a lot of folks saying, I'm willing to put that work in because it's worthwhile, and long term, this is going to be beneficial to our communities that we're trying to reach and serve collectively. So um, sorry if I'm rambling, but those are just ideas that I think about, and I think it really starts with us, the ask, and I think that came from Nora. We had other organizations who would ask that too, like, can you do this thing? And we're like, why? Well, okay, yeah, why couldn't we do that? And it's just seeking to understand, and I think that's where it all comes from. Ask the questions. And it may be that you're not able to, but I think you can still kind of, gently push that forward in your own area of work, once you know what the barriers are to getting that initiative pushed forward.
Annie, that's exactly what I said earlier, that you and Jen asked the questions. So everyone, I have to pop off. I have another meeting. It was, thank you for having me, and have a great rest of your day. Thank you.
Thank you, Reggie.
Bye.
And I'm going to give everyone a moment, an opportunity to share any closing remarks. We haven't had any final questions come in, so I'm just going to ask a follow-up to what Christy shared a moment ago on some of those other ideas that other municipalities may have tried, or that were great ideas that Christy's coming up with as well too. How would some of those different approaches impact the ability of For Tomorrow and IWCC to do your work? Or you could see it impacting other agencies on the East Side's ability to sustainably provide their services. All right, go ahead, Monique.
That's because I feel like I'm always talking. No, I mean, it definitely does provide a little bit more security for nonprofits, right? Where there's a little bit just more safety around, okay, we can try this new thing, or, you know, we need to adjust our programs, or this person has an emergency and we need to cover it. So I think all of that, those are the general feelings of this new model, or the models that we're looking at to really support the work. And I think I had another idea as well, and it kind of went back to Nura's point of the capacity building, right? And then ties into Annie's point of like, we're not going to need all of this support forever. Hopefully someday we'll be self-sufficient and we will be able to kind of build our own programs and figure out our own fundraising structures and all of that. But you don't do that until you have a community built and until you have support. And so really we're looking to the cities to help build that so that we can do more and serve more people.
I'm going to agree with both Annie and Monique on that. This is not a long-term ask, but it is an ask for until each organization is on their feet. And it's also IWCC's model, one family at a time, right? We partner with the family. We want to make sure they get to their self-sufficiency stage, and then we go to the next family, right? Because now from there on, they can take care of themselves and empower the next family. So, so I believe we're looking on to our cities for the same model, that trust in us with this advancement model, so that we're able to stand on our feet and be able to grow to be self-sustaining. Then we would not be needing that fund, and there would be newer organizations who would need that help, and we could offer guidance and stay collected, come together collectively to share our experiences as to how we got from there to here, right, to even our new emerging organizations. And I'm a person who really believes in collaborative effort, whether that is among community partners or partnering with cities, you know, states, and all the people that are involved in this puzzle of sustainability. If we are well sustained, we can help other families to be well sustained. And so we're each, you know, families are counting on us. We're counting on our cities to help us get there. So this is really not a long-term ask, but it's a process of growth. And once we get there, we're on our own, and we can focus on the newer emerging community partners to also get to where we're at. So it's information sharing, it's sharing our collective experiences, sharing the barriers, sharing how we came together and sort of help that needle shift slowly but surely, working in partnership. So I think all of that is really important, and all of it is based on starting that dialogue and building those relationships, just like Annie and Chen came to us and came to know us, came to know what we were doing, and then asked us who else is there that is doing incredible work like you guys, right? So they were not just limited to us, they wanted to know who else is around that is doing, you know, work in the East Side that we need to know about. And so I think it's important for us to continue to be connected and to foster this nurturing space for us, right, for the community partners, and for us to also help each other as community partners and collaborate, share resources. Our services do complement each other. So we are not always sort of repeating the same things, but we can help each other in terms of resources. And I really, truly hope that we could have a follow-up meeting where we can sort of maybe think about the building blocks of how we can make this happen before the next cycle. Because none of us can afford to not get funding for the next cycle. And most of us we're not able to be engaged in this reimbursable model. So I hope that this created an appetite for us to come back together more frequently before the next cycle and see how we can shift this model and build relations, not just the two of us, but with so many other amazing community members that are here today and some who couldn't join, and see how we can change the model and work together as collective. And really, thank you so much, Garrett, for this opportunity. And thanks to our cities for being part of this in the community. And Monique, it's always good to be in a space with you as well. Thank you.
Yes, and Nura and Monique, thank you so much for sharing. I think that is a perfect way for us to look to close this event with our final few minutes. And I am going to pass it over to a board member of ours, Councilmember DiMichele, in just a moment. Before I do, Nura, Monique, Christy, Annie, and Reggie, thank you so much for your participation in tonight's event. I am not only deeply grateful for your time and your expertise, but I think highlighting how we as an Eastside community are looking to provide more just, more equitable human services, and some of the opportunities and ways that we can look to achieve that in the coming years as well too. So thank you all for your participation. Just before I do hand it off to the council member, I am going to remind everyone who's in attendance tonight, we do run multiple events every single season. So please do keep an eye on our website for the dates and registration opportunities there. And if you are coming from a city and you are a member of the forum, reminder, we welcome your participation and enthusiastic participation in all of our activities, including our education committee that puts on these events. Without further ado, Councilmember DiMichele, I am going to pass it over to you.
Thank you so much, Garrett. Can you hear me just fine? Good. All right. First of all, thank you so much to our speakers. I have 3 pages of notes, and I'm really energized by the discussion. I thought it was a wonderful discussion and learned so much from everybody. So thank you so much. Garrett did a really good job of introducing the forum, so I'm just going to bring you up to date with some of the things that we've been doing lately. At the last meeting, we adopted the 2024-2029 strategic plan for the Human Services Forum. We have 3 strategic priorities in that plan. And the first one is to increase awareness of human services issues among Eastside community leaders and elected officials. The second one is to strengthen the Eastside human services community. And I think this event is a wonderful example of that priority. And we have many other things planned for the next coming months that will also help us achieve that priority. And then the last one is to strengthen the capacity and sustainability of the forum itself. In addition, we are also in the process of doing an executive director search. That job description was posted this week, and I just today sent it out to everybody who's a member of the forum. You can find the posting on LinkedIn under Eastside Human Services Forum, or you can contact me at my council email, and I'd be glad to share links and the job description itself. You could also ask me if you'd like to see the strategic plan. I'd be glad to share that with you as well. And then finally, we do have monthly meetings, and if you are interested, we'd welcome your attendance at those. So just let me know. We are using that time to increase our connections, because that is what we are here to do. And at the last meeting, we had a good discussion. We shared how The fentanyl crisis has been impacting our local communities and came out with a few items that we think can help us work together on that particular issue. So if you are interested in getting more involved with the forum, we welcome your participation. And then finally, we did assign a group of people to work on an advocacy task force that will start meeting next month. So thank you again for everybody's participation. And on behalf of the forum, thank you so much for this successful event. Thanks, Garrett, for putting it all together.
Thank you, Councilmember. With that, I'm going to call an end to the event, and thanks everyone for joining us today. Take care.